us from Maui today. We'll have other musical breaks throughout the series because we think that this had to be a celebration. And you can find Kelly in various spots on Maui. And he happens to be my old schoolmate from Lahainaluna High School. So, you know. So we knew that we would need music today because what we wanted to do is to create a celebration for National Public Health Week, because after the year we've had, I'd say that we can all agree that public health needs to be celebrated for more than a week. Last year, when we were planning this event, uh, it was early on in the year and COVID was still in the horizon. And as we were planning it and trying to figure out the topic areas, we thought, what exactly should we be focusing on um, and to be honest, we thought that maybe COVID might be done by the time April came around, that everybody would have forgotten about it, and this was last year. Boy, were we wrong. It didn't quite happen that way, as we know. So here we are a year later. We had to cancel our event last year, just like many of your own events in your organizations, and we got to work. And boy, was it work, wasn't it? Those of you who immediately started to figure out how to bring your programs online, we see you. And those of you who helped our communities to take care of their mental health, we see you. And those of you who were going from Zoom meeting to Zoom meeting to figure out how you can continue to provide the services to the people that are needed, we see you. And those of you who didn't know how you were going to keep your small nonprofit afloat, we feel you. So for today, Stephanie Meyer and Amanda Martinez, our co-chairs, and the rest of the programs committee decided that we needed to focus on the innovations and skills of our local public health community and what was shown in those last 12 months. Because we all had to MacGyver our way through this last year, we knew that this topic would resonate. And so consider today a celebration of what makes public health an invaluable foundation in our community. A great deal of thanks to our organizational and individual sponsors. At the Keiki level, the Hawaii Public Health Institute, the Hawaii Young Healthcare Professionals, Hawaii Pacific University Department of Public Health, Mental Health America of Hawaii, SM Hawaii, the UH Manoa Office of Public Health Studies, the University of Hawaii West of Oahu, and Venture Physical Therapy. We'd also want to give a big thank you to Amanda and Stephanie, who led us through all of this, Holly Kessler, our executive director, and of course our presenters for today. And before I turn it over to Stephanie, who will be moderating us today, I'd like to give a special mahalo to our Kupuna level sponsor for today's event, Hawaii USA Federal Credit Union. We'd like to welcome Kim Dodson, Hawaii USA FCU's Financial Wellness Manager, to say a few words. Welcome, Kim.
Thank you, Pedro. Thank you for having us here today. Aloha, everyone. On behalf of Hawaii USA Federal Credit Union, we first and foremost just want to thank all of you for your incredible work and contribution, not just during the pandemic, but before and after and beyond. Some people might wonder why a credit union is so interested in public health, but none of you are probably too surprised because you see this firsthand every day. We know that financial health is public health. When the American Psychological Association released its Stress in America survey last year, we were reminded that finances continues to be one of the top stressors for Americans. Nearly 64% and even higher than that levels for families earning less than $50,000 said that they are stressed about money, and it is one of their primary stressors. We did not need that report to tell us that, because we see it day in and day out with the community that we serve. And we see firsthand from talking to our members who are struggling. They've maybe been laid off or lost their job due to the pandemic. They're struggling to pay medical bills. They're maybe forfeiting their medical care because they're prioritizing food or transportation or something over that and letting it slide. We see the mental health and emotional toll that the financial stress is taking on our community. And that's why we're here today. And not just today, because we're not just celebrating this week. Just like public health isn't a week-long celebration for you, it isn't for us either. Financial health and public health, we're going to be here with you all of the way. So know that as you continue the incredible work that you're doing, when we think of that collective impact that we could have of different sectors working together to improve public health, we see our part in increasing and improving financial health, and we are committed to that. Financial wellness is really the core of what we do in providing financial education. As we've worked with our members this year, especially, they've seen that, wow, this isn't a place where I just go deposit a check or get a loan. No, we're going to help you with a budget. We're going to help you build a spending plan. We want for your financial dreams to come true and to build a healthy and strong community, because we know that that is a part of it. This year, we're launching a new program, partnering with local nonprofits, businesses to provide financial wellness in the workplace, offering free online digital education, in-person and virtual workshops, and even one-on-one financial counseling as well. So certainly, if any of you would love to, like to talk to us about that, we would love to talk to you about it. But enough about us. We want to get to the celebration because we are really excited to hear about all of the changes in public health, and we're looking forward to continuing partnering with you in the future. Thank you.
Mahalo, Kim. And I want to apologize. I was trying to share my screen earlier and it did not work while Pedro was speaking. So again, mahalo to our sponsors, especially Hawaii USA Federal Credit Union. So I want to again welcome everyone and say mahalo to Pedro for opening our event and introduce myself. My name is Steph Moyer and I'm an HPHA board member and co-chair of the event planning committee for today's event, and I will serve as your moderator for today. Before we get started, I wanted to go over some Zoom housekeeping. Please feel free to leave your cameras on, but remember to remain muted. Feel free to interact with each other via the chat box or with the reaction emojis. And just a heads up that we are recording today's event. Lastly, make sure you've grabbed your favorite beverage and snack, and we hope that you enjoy our presentations. We would like to share our agenda for today's meeting. We have a fun-filled event full of success stories from the community and more amazing music from Keali'i. We will also close the meeting with a mental health moment to ease us into the end of our workday. As you join the meeting, you are being serenaded by a wonderful local musician, and it's my honor to introduce you to him. Raised in Maui, Keali'i has been performing throughout Maui for more than 19 years for events big and small as a solo and group act. He was a Nahoku Hano Hano Recording Artist finalist in 2010 for Most Promising Artist and 2014 for Island Music Album of the Year. Due to the COVID-19 pandemic, he had to adjust with the times doing ukulele lessons and solo performances virtually and is back to playing in venues across Maui 3 times a week. We look forward to having Keali'i play a few more songs for us throughout today's program. As we transition into the presentation portion of our meeting, I'd like to ask that you please utilize the chat box for any questions that you may have for our speakers. We will hold all questions till the end of all 3 presenters. And it's my honor to introduce you to our first presenter, Nphw Kellen. Nphw is a community health worker for the West Hawaii Community Health Center in the Innovation and Transformation Outreach Department. She is fluent in Kiribati, Marshallese, and English, and received a certificate in community interpreting in 2019 from the Center of Interpretation and Translation Studies at the University of Hawaii at Manoa. Nphw chose to work at the health center because she loves helping the vulnerable community, which includes the Marshallese community, to be their advocate and assist them in navigating the health system. Without further ado, I'd like to turn it over to Nphw.
Thank you, Stephanie. Hello, everybody. Thank you for being here. So I'm gonna be, can everybody hear me? Hello, Stephanie?
Yes, we can hear you.
Okay, sorry about that. Okay, I'll be sharing my screen. Okay. So I really like the theme, as you can see on the PowerPoint that I have up in here. It says building bridges to better health, and that's the National Public Health theme for 2021. And to help celebrate the National Public Health Week, as previous speakers have said, that today is a celebration. I was asked, and it's an honor that Stephanie was able to reach out to me and ask if I'm interested to participate. And I said, yes. So the ask was for me to be able to share something positive about public health or share my experience while working with the community that I work closely with these masterlies during the pandemic, but to focus more on the positive effect from a CHW's perspective. So I know that the pandemic had a great impact on everybody's life, and most of us will remember the pandemic for its negative side. However, for today, I would like us to try and change our point of thinking. And the reason why I have I want to share the quote that it's up there, which says, with challenges comes opportunities. And most of the time, my boss, Dr. Leanne, always bring this up whenever we come across a challenge or something negative. She always reminds us that with challenges, we can always look from the positive side. And that's the only reason why I want to share with everybody. So, moving forward, in the midst of the most challenging public health crisis of our lifetimes, many bridges to better health for the Marshallese living in Hawaii was built or created back in 2020. And the reason why I'm sharing the bridges is trying to relate it with the theme for 2021. And what do I mean? What do I mean by the bridge here? There's a lot of bridges, and as we all know, as CHWs, we are the bridge to our community. But the focus that I'll be sharing today with everybody is the Hawaii Marshallese COVID-19 Task Force. I don't know if some of you have heard about us, or if this is your first time. I would like to share what happened during the beginning of the pandemic. So this task force served as a COVID-19 community resource and command center, or more like a bridge for the Marshallese community in Hawaii. So I would like to share a little history of how this task force came about. And it started with the initial conversation between our Consulate General Isabella Silk, Dr. Wilfred Alick, who is family practitioner at Kaiser Permanente here in the Hilo site, together with Dr. Neil Palafox, professor at University of Hawaii Medical School, and Barbara Tom, who is the retired public health nurse. And so the conversation just came about just to discuss during when our Marshallese community was hit hard back in the mainland, mostly Arkansas. And so we know that there's a demand, urgent, and immediate solution that we need to come about. I mean, we know that we cannot wait for our federal or county to act, and the safety of our community, it lies within us. So the purpose on creating this forum is mostly for community leaders to come about and discuss issues facing what our community is facing during the pandemic and how to respond it. The primary intention at the beginning was to mitigate and prevent COVID-19 from infecting our Marshallese community. Because we know by doing this, trying to keep our community safe, we are protecting others as well. And most of the members of this task force are volunteer members and representing all the Marshallese communities across the islands. Not just that, we also have other non-Marshallese that work closely with our Marshallese people all over the Hawaii state that are also very active and participate in this task force. So we meet since the beginning of the pandemic back in March. There's been meeting weekly on Thursdays, usually around 1 to 2 on Zoom. At that time, we have to be innovative, like what the previous introducers shared, that we have to be innovative on how we addressing public health issue. So it is during these meetings that everybody have to continue to share and update about the challenges and needs that our community has. So I want to share some of the highlights about this task force. And I might be wrong, but at the beginning when this task force was created, it was the only Micronesians or Pacific Islanders beside Native Hawaiians, which is an organized local community-based task force for the whole of our states. And as I shared before, it was chaired by our Consulate General, Isabella Silk, we, who works at the Office of the Republic of the Marshall Island Consulate Office in Honolulu. Before that, I mean, at the beginning, she was the one that chaired that before Dr. Halik took over. So during at the beginning of the pandemic in March, we haven't had any cases at that time. And so most of the time when the task force is meeting, is mostly trying to prepare our community before the virus could hit us. And so we are very fortunate to have Dr. Wilfred and Dr. Palafox in the task force, who continuously provide medical guidance and regarding the virus. So whatever questions and concerns that our community have, and we bring it to the table, they're the ones that we seek advice from them. I mean, not only them, but we have other sources, but these two physicians are the main advisors in this task force. We also have MCO, which stands for the Marshallese Community Organization of Hawaii. I don't know if some of you might have heard of it, but it's the first Marshallese nonprofit association in Oahu, which partner with this task force. And they play a major role in our task force because this task force is not, it's not a nonprofit. Remember, I shared before, most are just volunteers, participant members of the community. And so whenever there's an ask that needs some a nonprofit with a 501c, MCO is the one that is usually asked on our behalf. And I want to share one of the asks that they, sorry about that they did was through the One Hawaii organization, where we get 100,000 donations of disposable masks. And so these masks were distributed among all different Marshallese communities all over the Hawaii states. Also with this task force, we collaborate, sorry about that. There's collaborations with county office, the mayor's office, Department of Health, NHPI 3R committee, and other local agencies and nonprofit organizations. So whenever there's something that is concerning the, especially Marshallese or sometimes Micronesians, they reach out to this task force. I want to share some of the accomplishments since we are celebrating Public Health Week. Some of the accomplishments of this task force, and I've shared before, like the beginning was just education, and I have some pictures here, and this is the first picture on the left. That's just early March here in Kona, and that's when all community leaders come together, because we know that this is our responsibility to be able to protect our community. And this is just a picture showing free mask giveaway, and at the same time we're sharing approaches about COVID-19 virus. Even at that time, there was COVID testing that were able to be happen, and it's all because of the connection and collaborations with other agencies. And one of the, and a very good example is Auntie Jessie from the Kau Health Center, who work closely with our Marshallese community in Ocean View, and who helps us makes it happen to do the COVID testing way back when our community was hit by the pandemic. Also, this task force play a lot of role in wraparound services, helping our community's members that were affected, who got positive with the virus, and they don't know how to navigate the health, all the resources. And so a lot of members of this task force in their different district or different islands were the main people that were really providing resources, guidance to our community. The task force were also involved in unemployment benefit applications. As you all know, most of our, especially the elders and those that don't speak the English and doesn't understand that, will need guidance and assistance with that. And another accomplishment that happened from this task force is the involvement together with the NHBI committee to be able to make it possible for the Department of Health to recognize and acknowledge that they need Pacific Islanders, and especially the people from the community that speak the language, to be able to help our community. And so we have some members of our task force that have received training and become contact tracers. And the last accomplishment that I really want to share is as we all know, that it's the main talk of the month, or the previous month, is vaccination, the COVID-19 vaccination. So a little bit history share when vaccination started, and everybody know that we have the tiers that we have to follow from the Department of Health. And everybody knows that when it's come down to the age, it starts with the elderly, 75 years old. But for your information, most Micronesian, and mostly in my Marshallese community, we don't have a lot of 75-year-olders. We have few. And so it has become, since when vaccination started here in Hawaii, it has been the concern and issues and the talk in the task force to how can we be able to provide and help? How can we become innovative to be able to provide the service to our people? Because to us, that's discrimination. And so we have to, with challenges comes opportunities. And so I have to commend our chairperson, Dr. Alik, because he was the main, because he works with Kaiser Permanente Clinic. He was the main advocate for our task force, and he was able to convince the COVID-19 Kaiser Permanente team to agree, because I think their concern is, if we bring the vaccine, if we're doing a mass vaccination in Kona, are you guys going to be able, the community, will you be able to, because the main concern is community involvement. And I'm happy and glad to share that it did happen. In April 3rd, we have a mass COVID-19 vaccination for the COFA citizen, plus Pacific Islanders, plus Filipinos, happened here in Kona at Kaiser's Permanente Clinic. And we were able to see vaccine about 400 plus people, and 90% of, I'm so proud and happy to share that 90% of people were from our Marshallese community. And the reason why I say I'm proud with these is because when vaccination started, there was a lot of fear in our community. And so as most of members of the task force takes upon us the responsibility to be able to help educate and increase awareness among our community and reassure them that it's safe and it does work to protect you from the COVID-19, so that when you get it, you don't have three things that Dr. Alik usually want us to share is it's a fact, and these are the things that I share with my community and be able to convince them to get the vaccine. It's a fact that it will prevent you from going to the hospital. It will prevent you from ending up in the ICU to be intubated, and it will prevent death. And so this is a very big accomplishment. There's still fear with some of our community, and that's one of the tasks now that our task force is working on, to continue educate our people to get vaccinated. I think this is the end of my presentation, and I would like to say thank you and close it with a Marshallese saying. Unfortunately, I don't have time to have it here, but it says, Wakuk Wachimor. And what it's represent a canoe. And what it's to simply basically interpret what it means is canoe is to bring us together. Canoe is belonging to everyone. So if we all together, we know that the va or the canoe is moving in one direction. So happy Public Health Week to everybody. Thank you for spending the time this afternoon with us. Aloha.
Mahalo Metu, that was beautiful. It's now my honor to welcome back Keli'i for another song.
Life is like a jigsaw, pieces out of place. Come on, put a smile on my face. If on my bad days, give it once. Know just what to do. Come on, only you can see me through. If you think I need you, come on over. Bring your love around. Only you can dry my tears. If you think I need you, come on over. Lay your body down. No, I'll be right here. Bring your love around. Do, 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 do. Do, 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 do. Can't see in front of me. No, my darkest days, come on over. You can take this pain away. If on my bad days, give it once. Know just what to do. Come on over. Only you can see me through. If you think I need you, come on over. Bring your love around. Only you can dry my tears. If you think I need you, come on over. Lay your body down. No, I'll be right here. Bring your love around. Do, 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 do. Bring your love around. Do, 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 do. Bring your love around.
Mahalo Keli'i. It is my honor to introduce you all to our second speaker for today, and that is Michelle Chow. Michelle is the founding director of 3 Oahu clubhouses and currently oversees the Ko'olau Clubhouse in Kaneohe, Oahu. She has been Clubhouse International faculty and has worked on accrediting Clubhouse programs. She continues to work to decrease stigma, increase recovery efforts through reintegration into the community, and spread information about resources in the community. Michelle will be sharing with you about Ku Makani, the Hawaii Resiliency Project, a new program in our state for individuals and/or families, agencies, or organizations who have been impacted by COVID-19. A partnership with the Department of Health and funded by FEMA and SAMHSA, Michelle will be sharing what their program has to offer. And I'd like to turn it over to Michelle.
Mahalo, and thank you for this opportunity to share about Kumakani. And it is a great opportunity for a lot of our team. We have crisis counselors that are all motivated to help the community. We have been in existence since the middle of January, and our program will be through mid-October. So we work through Care Hawaii, and we work at through a number of their sites, but it's the Kumakani Resiliency Project is to help our community from Keiki to Kupuna deal with this COVID crisis. And we have 5 pillars that we really look at to help. We have trained crisis counselors, people who can call, and it's anonymous and non-judgmental. And we're a little bit different than in other crises. We're outreach oriented, and we're doing Zoom just like everybody else. And people can call during our hours. We're open from 4 to 9, Monday through Friday, and 9 to 9 on weekends. So we have counselors on each island and each community, and they all have different strengths, and they try to reach out to their own communities to find out what the needs are for their communities. And we work with individuals, families, keiki, kupuna, and agencies and organizations. We've partnered in different ways when we can't physically go out to meet people in need. So our crisis counselors have created a lot of virtual programs, and they're exciting. And I think the exciting thing about them, they're free and they're easily accessible. There's things from talk story about insurance, mindfulness, a keiki talk story, yoga. We have a kupuna corner, mindful moms. There's a women's group, and hair and makeup. So you can get to these, you can register for these programs through the Kumakani website. And if you go to that website, you can see the list of all the Zoom activities. These brochures are available for anybody. We can mail them out, we can drop them off and deliver them to any agency or groups that think they might have need for them. So this kind of is an overview of all the things that we provide. So again, it's free, anonymous, non-judgmental, and for all people. We're here to help with anything that might be COVID related. Kids that are dealing with being at home, kids that are dealing with going back to school, parents with the same thing, having to teach and continue to work, kupuna who are isolated, people that have lost their jobs, stressed out about money, dealing with just the ongoing stress of the pandemic. We also have these brochures that we can drop off or mail, and these are tear-off brochures that we can mail out to you. So again, we have teams on every island. So we have 2 teams on the Big Island, in Hilo and in Kona. There's a team in Maui. There's an East Oahu and West Oahu team, and on Kauai. You can reach any of these teams by just emailing them at kumakani.org. You can email us, and you can also reach us on social media on Facebook, Instagram, and Twitter. And the way that you can reach us by phone is the 1-800, you have to call through Hawaii Cares and ask for Kumakani. So one of the things I wanted to talk about is some of our frequently asked questions that come up with us. Oh, I must have downloaded the wrong slide. I'm gonna ask for questions while I go to the site. And I apologize because I downloaded the wrong slideshow. So if you have any questions, I'll take those while I try to get to the Kumakani website.
Hi, this is Steph. I'm just going to jump in while Michelle is pulling up those sites. Since there are a number of folks on the meeting today, I do ask that you please put your questions into the chat box, and I will be collecting those, and we will moderate, or I will moderate, the Q&A portion of our meeting at the end of our third presenter.
So this is our Kumakani website. It was created by our crisis counselors. And you can see there's resources that are listed for each island community. So our crisis counselor teams have researched and found out what are the needs and what are the resources in each area. And so you can see for Hawaii, Maui, Kauai. And then our virtual groups that are available, you would just click here, and then you just scroll down, and you can sign up for any of these sessions that are free. And so they go from family supports, talk story for teens. So any of these classes, if you want hair and makeup, so you would just click on here, and then you just sign up. And then when you finish signing up, you'll get the Zoom link. So it's fairly simple to sign up. And there's just some basic information that we're looking for. And then if you look for us on Facebook, if you go to you see my Facebook, Kumakani. One of the things that is really nice on Monday evenings, we have a Monday healing through arts. And so these are some of the groups that we've had on singing. The Tonga Sister, from Kauai, we had Kyle J. LeBenz. This also lists, you can see that we post regularly the groups that we have per day. So each island is doing different groups. So there's all kinds of things that you can see that we have a craft night will be going tonight. And so there's a lot of resources that we have. So you can find them on our website, on Facebook, and also on Instagram. But again, you can just call us on the 1-800 number through Hawaii Cares. And if you're on Oahu, you can use the 832-3100 or the toll-free 1-800-753 number. Some of the frequently asked questions are like, how long will we be doing this? Again, it's a FEMA grant that goes through October. Another thing is, how do you guys partner with current agencies since you're only time limited? One of the things that we do one of the things that has been happening on Kauai is some of the crisis counselors have helped with a group that reached out to them and helping with homework with some kids that need help with homework. We also have a veterans group that veterans can come out and maybe join that group if they want to receive services that way. We also have counselors that all speak different languages. We have we have counselors that speak in Tongan, Samoan, Cantonese, Mandarin, Vietnamese, and understands Marshallese. So if there's any questions, I could take them at this time. And that's about all the information I have at this time. Does anybody have any questions?
So Michelle, we're actually going to hold questions till after.
Okay, I'm sorry.
No worries. Thank you so much for that wonderful presentation.
So we want to reach out. I think one of the things that we found is there's been a little bit of lag time with Hawaii Cares. We just did an in-service with them. So hopefully if you want to reach our counselors, you just have to ask for us. You can always email us. If someone calls and we're not open, we do take messages and we'll call those back. And we can do up to 5 outreaches after the first call. Thank you very much. Have a great afternoon. I really believe in public health.
Thank you so much, Michelle. And we did share the Kumakani website link in the chat box, so please feel free to grab that before the meeting is over. And last but not least, I'd like to introduce you all to our third panelist, Dr. David DeRoff. Dr. DeRoff has been with Kokua Kalihi Valley for 32 years. In 1989, he was hired as KKV's first clinical director and remained in this position until being named as KKV's executive director in 2003. Dr. DeRoff has served as assistant clinical professor of public health, medicine, and nursing at the University of Hawaii. He serves as a board member of the Association of Asian and Pacific Island Community Health Organizations, the Hawaii Primary Care Association, and Aloha Care, a Hawaii Medicaid managed care corporation, as well as Lawyers for Equal Justice. He is also a member of Na Limahana o Lonopuha, a consortium of Native Hawaiian health organizations. And without further ado, I'd like to hand it over to Dr. DeRoff.
Thank you so much, Stephanie. So nice to see everyone here today, many familiar faces, and quite a few new faces too. Former co-workers, Stephanie, current co-workers, colleagues. What an honor to be amongst all of you at this time. What a year it's been for all of us. I don't think any of us expected to have a year like this in our lifetimes. Most of all, if I convey anything, it is to convey my deep thanks to all of you for the sacrifices you made this last year, your families made, our communities made. We have a lot to be proud of here in Hawaii. I heard that Pedro started out by saying we should be celebrating. We've done an incredible job, and indeed we should be. I heard wonderful. He also mentioned the need to MacGyver, and it has been a year of MacGyvering. And hopefully I'll give you a sense of what that MacGyvering looked like at KKV just a little bit. I love the theme of paddling together in the canoe. It is something, if there's any reason why Hawaii might have done better than most places, that's certainly got to be high up there on my list. Because we do know how to work with each other still. That didn't mean we didn't often have disagreements, that we were in each other's hair, that we were at cross purposes sometimes, but overall, we do that pretty darn well here in Hawaii. And that theme of resilience that we just heard about, so critical now as we still struggle in so many ways, both from the pandemic and the effects of it on our community. I'll get started here. I'm gonna just walk you through this a little bit. Excuse me while I put on my glasses because my vision isn't particularly good today. I'm David DeRoff. I've been with Kokua Kalihi Valley since 1989. I actually came to Hawaii to go to public health school at the University of Hawaii. About a week before school started, I took a job with Kokua Kalihi Valley School. Actually, as Dr. Katz could attest, went onto the back burner for me somewhat. It took me 7 years to complete my MPH, which, by the way, is not a record. I think there are people who it actually took somewhat longer than that, but it's got to be pretty close to a record. And I've just been fallen in love and have had this incredible love affair with this community that I'm in of Kalihi. Our mission statement came in really handy this past year. Reconciliation and the alleviation of suffering. I mean, how do we serve communities? Through strong relationships that honor culture and foster health and harmony. And those themes, I hope you'll hear in some of our slides. You know, from a public health standpoint, I could spend the next 10 minutes talking to you about the horrendous data that struck some communities in Hawaii, including our community. We know, all of us, I think now know that Pacific Islanders have been most adversely affected in our islands. Just, incredible inequities and disparities in the outcomes that we've seen in terms of deaths and number of cases per 100,000 people. But I really don't want to spend today dwelling on that. It doesn't, I don't think it serves us, and it certainly doesn't represent the mindset and the kind of work that occupied our minds at KKV during these past 12 months. But we're certainly absolutely mindful of it. If we take ourselves, all of us, if we just close our eyes for just a moment and think back to a year ago, and what were we dealing with? What did that feel like for each one of us? I think we can remember fear coming into play, wondering how this would affect ourselves personally, our own mortality perhaps, our families, what would happen to our work, what was going to happen to our loved ones and our kupuna in our communities. What would Hawaii look like? How long would this last? Those are some of the things I think we will all remember struggling with a year ago at this time. But I'm really actually pretty grateful that at KKV, we had come into that period of time a year ago, having just completed about a 5-year process of regrounding ourselves in the values and understanding of ancient wisdom that exists in our community. And with that grounding consisted of several years actually of intimate conversations throughout our community, amongst our staff, face-to-face, over food, slow, gentle, caring conversations where we really wanted to listen to our community about their understanding of health. And when we did that, we found that there were some very consistent overriding themes that came into play. And some of you have seen some of the work that came out of that, perhaps from us. The framework became known as Pilina Ha, and it really is all about connection. How health in our community is a sense of being connected to a place, to the ahupua of Kalihi in this case. It's a sense of being connected to your neighbors and your family. It's a sense of obligation and commitment to the past, present, and future. And it's a sense of connection to our better selves, our kuleana. What are we responsible for? That grounding that we did, we reorganized the staff to work in cohorts. Over each cohort lasted several months, and interdisciplinary groups, really grounding them deeply in those understandings, building relationships with each other in-house, asking ourselves, what can we do to strengthen the quality of the relationships, both inside our organization and from KKV to the wider community. That really enabled us from day one to enter this pandemic with great confidence, with a great understanding of what our work was going to be. We didn't skip a beat. I honestly, looking back, I am so amazed at the people I work with who came to work each day saying, what can I do for our community today? What will my work look like tomorrow? I know it's going to have to look different. Imagine our elder program. We serve 1,600 homebound kupuna in the Kalihi area. Many of them would come to several centers that we run for congregate dining and exercise. We knew that couldn't go on. That was the first thing to be shut down because the risk was just too high to the kupuna. And we knew then too that those people were at great risk of being isolated, going into depression, et cetera. That group immediately set out to say, but we know those people and they have telephones, or if they don't, we can knock on doors. And they reorganized themselves in about a week's time to begin reaching out by phone, asking the kupuna how they were doing. Did they have enough food? Did they have a way to get their medicines? Were they going to be okay? you can't believe the kind of response we heard from people. The stories so often were, I thought I was going to be all alone, and you guys were there for me. It helped us tremendously. Out of that work came a larger initiative that we birthed for the first time at KKV that we call Hui Hoaka. We actually had two large COVID initiatives. The clinical side, we called the Nakoa Clinic, which was a clinic just dedicated to taking care of patients with COVID. On the community side, we birthed Hui Hoaka. Some of you might be familiar with the this Hoaka symbol. It's the shape of the moon. This particular crescent shape is when the earth and the sea are most abundant. And so Hoaka really could be translated into English as team abundance. And our team abundance set out to build upon the work of our elder program in finding food resources. Really, a lot of that was logistical work. We were used to, we do food systems work in the community, but we had to really ramp things up. So we went from about 500 pounds of food that we were moving through our organization a week to about 7,000 pounds a week, most of which was organic, healthy, cultural foods that our community was really particularly ono for. You know, when you're sick, or when you're isolated, or when you're scared, what kind of food do you want to have? Well, you want to eat the food of your ancestors. You want to eat your comfort food. And so to the extent that we could, we were providing those kind of food supports. We were doing daily deliveries to many households, those that were affected with COVID and who couldn't go out, those who were affected primarily economically or by the lockdown. A lot of the work was making sure people had access to telehealth. Many of our community don't have iPads or internet connections, so we set about providing people with those kind of connections. We had to, work hard to overcome natural resistance to things like being tested for COVID. Let me just share a couple of stories that might stick with you more than the rest of this. One, early on, we knew the messaging from the state wasn't reaching many people in our community, particularly in our Chuukese community. I called together a meeting of ministers from the community, mostly Chuukese, some Marshallese, and we began to meet on a regular basis. We've now been meeting every week on a Tuesday night for the last year. The meeting starts at 8 o'clock. I usually jump off at about 10 o'clock. Oftentimes it goes on until about 1 o'clock. If any of you are ever interested and want to take part in it, let me know. It is an incredible experience. But in one of those early meetings, when we were trying to encourage our community to come and get tested, excuse me, I'm just gonna try to shut that off. One of the ministers said to me, "So Dr. Groff, suppose I come in tomorrow and get tested and I'm positive. What are you gonna do? Are you gonna, because if I'm positive, I live in a really crowded household. Surely you're not gonna ask me to go back home and perhaps risk spreading this infection to the people I live with, my family, my parents who are elderly." And, it was really a wonderful moment for me to be challenged that way. It really formed a basis for so much of our work to think, if we're going to be doing this work, if we're going to be involved in this COVID work, we have to commit ourselves to excellence. And excellence would not be the only option of sending someone home who tested positive. And so we really worked hard together with the Department of Health, with the city, to stand up the hotels so that people could isolate in hotels. That was just one example of the beginning of this conversation with the community, where the community were really calling us to do better. My very first patient with COVID was a woman in her 40s. I wasn't particularly worried about her health with the virus. She was quite strong person, but I was worried about the possibility of her spreading the infection. And as you know, we were encouraging people to isolate whenever possible. Well, once again, when I called her to let her know that her test had come back positive and that she would need to isolate, she immediately said to me, "Dr. Groff, you're asking me to stay home from work for the next 2 weeks. Do you know that I'm the only person in a household of 10 with a job right now? And without the income from that job, there's no prospect of food on the table or paying my rent." And again, we had a lot of learning to do, that the simple public health message of test, trace, and isolate wasn't going to work. And one thing I'd like everyone to take away from this Hui Hoaka is really about the blanket of support that we need to wrap around each step of the way. If we're going to test people, it has to be done with incredible humility and patience and support. If we're going to isolate people or have people isolate, the same thing. They're incredibly deserving of our love and care and support. And I'm really proud of the work that was done. We were able to bring on a lot of new young staff, many of whom are still with us doing work now, leading immunization initiatives and the like in the community. We learned what we knew all along from this. We learned that relationships matter greatly. And if they're in place and if they're strong, you're ready to go. We learned that so much of the agency lives in our community. We have to honor that agency in everything we do. And in fact, you know, just before I leave you, because I know I'm out of time here, and I could probably talk for another hour and you'll all get terribly bored. But, you know, one of the real overriding questions that I have about our work and about our work going forward, one of them is that about agency, and what can we always make sure that our actions are contributing to agency and sense of sovereignty in our community. And I think it's an incredibly important question for the public health community. When we're doing public health, are we always mindful? Is this public health increasing personal and community agency? Two other questions. What does excellence look like in public health services? The community is calling upon us to be excellent. We should always ask ourselves to be excellent. And finally, how can we be intentional to make sure that the changes that we're making right now in response to this pandemic are not just changes for this last 12 months? How do we make sure that those changes are things that will last long beyond this, that they're things that we believe in, that they're at the core of our values? So that's all I have for you. And again, my heartfelt thanks to each and every one of you for the work you've all been doing this past year. If we could, I'd love to either give you a deep bow right now or a big hug. Thank you very much.
Mahalo, Dr. DeRoff. Okay, so I will move right into our Q&A portion of the program. And maybe Dr. DeRoff, we'll start with you since you're still on. There was a question about contacting you for those that are interested in the community meetings. Are you willing to share your contact in the chat box tonight?
You bet.
Okay, awesome. The next question is for Nphw. So Nphw, there was a question asking, are there available, oh, excuse me, it's not that question. Can you talk about the need for more trained interpreters and how you see that happening?
I think it's always been an issue, even with, can you, oh yeah, I'm not on mute. It's always been an issue with that there's a high need for interpreters, especially even with Marshallese. There's a need, but there's not enough trained interpreters. And so there was a point of time that we did discuss it in our task force, and that we're waiting, they were sharing that there's a grant or something that might be able to provide training for the whole Hawaii state. So yeah, I mean, I know that even here on the Big Islands, we get pulled a lot, not just in health center, but schools, housings, everywhere in the community. So yes, I do agree that we need more training, and I don't really know. I mean, in this task force, we have a lot of people that there's some of them that work with public health, not public, Department of Health in Nphw, and they're the ones that are interpreting and translating some of the materials. So I don't really know if I answered the question.
Yeah, I think that's great. Thank you. So the next question I may actually address to Dr. Duroff, because there was a question if there are available trainings for medical interpreters or translators. And I believe KKV was a hub at one point for that, but are there any currently available?
Yeah, that's a great question. I've been thinking about that. You know, we've been doing that for 20 plus years. And we've not been doing it during COVID, although it's perfectly suitable for Zoom format, I think. So I have been meaning to pester our staff who are leading that effort to see if they have the wherewithal to reintroduce that. I think there is a tremendous need for medical interpreter training, as we all know. I'm hopeful that one thing that will come out of this crisis is a deeper understanding that it's not acceptable to not do a wonderful job providing good interpretation and translation of materials and the like. We absolutely need that. It's really unacceptable that people should be deprived of really good, trustworthy information. So often, one of the first things the ministers told me is, we don't know what to believe. We turn on the TV and we hear conflicting messages. We go onto Facebook and we hear conflicting messages. We're not sure what source of information is trustworthy. No one seems to be reaching out to us to talk about these things. That's what that Tuesday night meeting became, was just a forum to discuss things, to hear each other out, to share stories with one another.
Thank you. And another question for you, Dr. Duroff. How does the new federal COVID relief package help KKV or other community health centers in our state?
Yeah, so it's a one-time infusion of cash to the health centers to really ramp up their COVID efforts. Obviously, I think the intent is really particularly around the area of immunization. We, by and large, the immunization, to do the immunization process really well on an ongoing basis is actually kind of costly in a community. Like, we're not doing, mass 500-person events. We really are trying to make sure that the delivering of a vaccine is tied in also to broader supports. People need assistance with food, housing, utilities, childhood education, and the like. So our events, we're really trying to make it not just about the vaccine, but to offer those. And so that kind of support that we're getting from the federal government will allow us to continue to do that work on an ongoing basis. We're currently running 3 clinics a week. We're doing about 500 immunizations a week right now. We'll probably ramp that up a little bit over the next month. If we can find staff, it's really, actually, now that we have money, it's really actually not that easy to find qualified medical personnel. There's a real shortage here in Hawaii, as you all know. Salaries have not kept pace in our environment with the hospital, so we're oftentimes losing staff. So yeah, we're gonna try to be able to recruit more people to continue to provide more services and support to our community. That's it. So that it takes the heat off of us a little bit. And as you know, we have to shut down quite a few of our programs and services. So like many organizations, it's been challenging, but it's remarkable that the federal government did step in a really robust way. It's in 32 years, I've never seen anything like it.
Thank you. So our final 2 questions are for Michelle. First question is, can you share who the team lead on Molokai is?
So Molokai would be covered by the Maui team lead, and that's she's just barely taken over Her name is Catherine Chan. So it's Catherine with an A in the middle. So I can put her email in the chat.
Perfect. And the second question for you is, are you able to share any demographics or geography of those who have participated in the Kumakani program?
So up to date, we have had a variety of callers, but there probably has been predominantly Kupuna reaching out. We have had some medical folks call in that were having just a hard time dealing with stress. And then we have had some calls just, early on, we had people calling that were recently diagnosed. And then we've had some calls also trying to get vaccinations. So it's a wide range. Also, we've, the Hilo, because they responded to the volcano, we had more connections in the community. So their Zooms participation is a little bit higher than the other islands.
Thank you, Michelle. Okay, well, I would like to give another huge mahalo to all of our presenters today, Dr. Duraf, Michelle, and Nphw. Thank you so much for joining our event. And now I'd like to ask you all to sit back and relax and enjoy a little more music from Keli'i.
Going to the island of the valley, to Lahaina, Lahaina, where the mountains are green. That's where you'll find me in Lahaina, Lahaina. They say that Maui, go away, and I agree, 'cause Maui, go away. It's the only place for me. That's where you'll find me. Down by the seaside, watching the moonlight, twinkling starlight, morning sunrise, the golden sunset. In Lahaina, Lahaina, they say that Maui, go away, and I agree. 'Cause Maui, go away. It's the only place for me. That's where you'll find me. Down by the seaside, watching the moonlight, the twinkling starlight, the morning sunrise, the golden sunset. In Lahaina, Lahaina, posing our questions throughout as they disappear all too soon. But I wondered much further today, not sure. Can't seem to find my way back to the woods. So help me if you can. I've got to get back to the house. I'm going to my wood. You'll be surprised there's so much to be done. All the bees in the highway chase all the clouds from the sky. Back to the days of Christopher Robin. Winnie the Pooh doesn't know what to do. Honey just upon his nose. Empty, asking for help and advice. And from here, no one knows where he goes. So I wondered much further today, not sure. Can't seem to find my way back to the woods. So help me if you can. I've got to get back to the house at the corner of my wood. You'll be surprised there's so much to be done. Now all the bees in the hive chase all the clouds from the sky. Back to the days of Christopher Robin and Hood. Winnie the Pooh doesn't know what to do. Honey just upon his nose. Empty, asking for help and advice. Then from here, no one knows where he goes. So I sent him to ask, oh, while he's there, how to loosen the jar from the nose of the So help me live free. Yeah, I've got to get back to the house I'm going by one. You'll be surprised, there's so much to be done. Got all the fears in the house. Chase all the clouds from the sky. Back to the days of Mr. Rabbit. Back to the days of Mr. Rabbit. Back to the days of oh, 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 oh. Mahalo nui for having me. Thank you to Stephanie for being our moderator. Mahalo Pedro for having me. And thank you so much everyone for all the wonderful information. We're doing the best we can. Much love to all of you. Take care. God bless. Aloha.
Mahalo, Kelly. And good luck on your next gig this evening, too.
Thank you.
Okay, so without further ado, it's my pleasure to introduce you to my co-chair for today's event, Amanda Martinez, who will now guide us through our mental health moment.
Great, thank you, Stephanie, and thank you so much, everyone, for joining us this evening and sticking it out after our workday has ended. I want to take this opportunity to help us relax a little bit as we transition into the rest of our evenings together. So we're going to be going through a couple really quick short exercises, just different examples of various coping skills that we can use. I hope that you take that time to prioritize your mental health, to make that time for your own self-care. You know, we are in that type of profession where we are giving to a lot of people. And if we're not taking the time to take care of ourselves, then how can we expect ourselves to try to take care of other people? So it's super important that we are, you know, turning that reflective lens inwards and doing things to prioritize our mental health. So I'm going to show you a couple different coping skills that we can do really quickly in the moments whenever we experience increased levels of stress or anxiety. What happens is our nervous systems become activated. So we have these, you know, specific reactions. So even though we're not running away, hopefully from any predators or, you know, saber-toothed tigers anymore, our bodies still react to that stress and to that anxiety. So that response is still activated. So these coping skills are hopefully going to help you kind of calm down your nervous systems a little bit, to reground you, bring you back to the present, and make you feel a little bit more capable and prepared to tackle whatever problem you may be facing. So I want to start off by just showing you how to breathe, right? So I'm sure some of you in your heads right now are thinking like, well, Amanda, I know how to breathe. Like that comes naturally to me. Why do I have to remind myself to take a deep breath? And you are right in a sense, you know, we are not always aware of the kinds of breaths that we are taking, but sometimes we do have to remind ourselves to just take a moment and take in that deep breath to bring oxygen back into our body. So the kind of breathing that we want to strive for is that deep diaphragmatic breathing. So instead of pulling from that upper chest area, we really want to pull from that diaphragm area, which is more towards the top of our stomach. So we're going to take a couple deep breaths together. I'm going to count you through it. And if it helps you to pull from that diaphragm area, you can take one hand and put it on your chest. You can take your second hand and just put it right above your belly button on the top of the stomach. I know I'm a little off camera here, but hopefully you can see just a little bit right there. We're going to take a deep breath together. I'm going to count you through it. And as you're taking in that deep breath, I want the hand that's on your stomach to push out further or to move more than the hand that's on your chest. Right? We're going to be really aware of pulling from that diaphragm area. So let's try this a couple times. We're going to take a deep breath in. 1, 2, 3, 4. Hold for a second. And back out. 4, 3, 2, 1. Perfect. Okay, let's try it one more time. We're going to take a deep breath in. 1, 2, 3, 4. Hold for a second. And back out. 4, 3, 2, 1. super simple, right? So we're already starting that process of being in the moment, being relaxed. If it helps you at this time to close your eyes, if you feel comfortable in doing so, feel free to do that. The next exercise we're going to be going through is a really short progressive muscle relaxation exercise. So, you know, sometimes when we experience those higher levels of stress and anxiety, we really start to carry that tension in our bodies, right? So if you're anything like me, I carry that tension in various parts of my body. So that's when you start to feel those headaches, you know, that tension in the jaw, maybe in your shoulders or back a little bit. So progressive muscle relaxation is a way for us to use our bodies to trick our minds a little bit, right? To send that message to our brains that we are calming down, right? We're calming down that central nervous system. So building upon the deep breathing skill that we just learned, I want you to find a comfortable seating position. And again, if you feel comfortable closing your eyes, you may do so. If you feel more comfortable turning your camera off as we go through this, that is okay as well. I want you to just take a moment and really focus on the center of your body. So let's take in another deep breath. And slowly exhaling. So continuing taking those deep breaths, we're just going to move through various muscle groups. So I want to start with our foreheads. So if you can raise your eyebrows as high as you can and hold it for 1, 2, 3, 4, 5, and release. Okay, so as you're taking in those deep breaths and exhaling, I want you to imagine that tension releasing from your body. Wonderful. So let's move on to our mouths. Okay. I want you to smile as big as you can and hold it for 1, 2, 3, 4, 5, and slowly release that tension from your cheeks. Great. Taking another deep breath in. And slowly exhaling, imagining that tension slowly releasing. We're going to move on to our shoulders next. So I want you to raise your shoulders as high as you can and hold it for 1, 2, 3, 4, and 5. And then slowly release that tension in your shoulders. Continuing with your deep breathing, imagining that tension releasing along with your exhale. Wonderful. Okay, now we're going to move on to our hands. So pick one hand, either the right or the left. We're just going to make a fist as tight as we can. Be careful if you have long nails that you're not digging it into your palm. Okay, but we're going to make that super tight fist and hold it for 1, 2, 3, 4, and 5. And slowly release that. Maybe shake out your hand a little bit and get that tension. Taking another deep breath in. And slowly exhaling. We're just going to move to our opposite hand. Make that fist as tight as we can and hold it for 1, 2, 3, 4, and 5. Slowly release that tension. You shake out your hand a little bit. Wonderful. You can take one more deep breath in. And slowly exhale, letting that tension go. And then we can slowly start coming back into the room all together. Amazing. Good job, everyone. Hopefully you're feeling a little bit more relaxed. So with that, let me pass that virtual mic back over to our wonderful moderator, Stephanie, and she can start closing us out for the evening. Thank you.
And that was so nice. Now I have to come back and wake up and let us all move on with our evening. But before we do that, I do want to say some mahalos. And as we close out our National Public Health Week event, I'd like to take a moment and share some of the photos that you all shared with us that helped lift our mood during the pandemic. So I think it's safe to say, and we've heard from other speakers today, that none of us could have imagined what we've all been through over the past year. And yet out of the darkness, there is always light. Whether it's been our family, friends, pets, nature, baking, crafting, reading, or reflecting, despite the hard times, there's always something to be grateful for. On behalf of the HPHA board, I want to thank you all for joining us tonight. I want to thank our sponsors, our guest speakers, the event planning committee, and my co-lead Amanda for making this event possible. If you are not yet a member of HPHA, I do encourage you to join this amazing network of individuals and organizations. We do hope to see you at a future HPHA gathering. Please stay safe and healthy, and I wish you all a wonderful evening. Mahalo.